People often say PCOS is untreatable. Is it really so? Do we really have no treatment for PCOS? So hello everyone, this is Dr. Anjali Kumar, once again bringing you greetings from Maitri. Maitri is a space where we talk anything and everything about women's health. I realized this very early in my practice that treatment of PCOS using hormones or maybe the birth control pill is not the right answer. When we routinely use a pill to regularize the period, that's not the treatment. The doctor and the patient are back to square one as soon as we stop that treatment. In fact, all the symptoms of the PCOS like irregular periods, obesity, difficulty in losing weight, increased hair growth on the body, or acne are actually the end result of a bigger game which is being played inside. In fact, I say that the poor ovaries, the ovaries which become bulky and the polycystic, are actually the victims of a bigger problem which is going on inside. That bigger problem is the high insulin levels, insulin resistance, and so on. PCOS is a metabolic disorder and it has to be treated by treating the factors which in the first place cause the PCOS. Correction of the lifestyle is obviously the best answer to it. But what is the right lifestyle? Everybody talks about following a good lifestyle. My experience with yoga tells me that this is the finest lifestyle. Yoga not only talks about the asana or the exercises, it talks about the right diet, it talks about healing a person at the mind-body level, talks about the correct breathing, talks about the positive state of mind. We started our experiments way back in 2015 when we started using yoga as an aid to heal the patients with PCOS. And since then, we have been getting consistently good results. So today, once again, I invite my yoga teacher, Mr. Arun Pandala, to help us about this discussion on PCOS. So hello, Arun, once again, and welcome to Maitri.
Thank you very much, Anjali, for having me on the program and on the channel. And yes, I'm glad that we are discussing this once again. Many years ago, to be precise, in 2015, when Anjali approached me and asked me if yoga has a solution for women with PCOS, I immediately said, yes, we can definitely look at it. And the confidence I had was, of course, my own personal experience of teaching yoga to thousands of people over the last 25 years, where people have been able to get a lot of relief and also recover their health through the practice of yoga consistently. We started a program way back, 15th of August, 2015, to look at women with PCOS and how yoga can help them. And we've had wonderful results. Many of the women were able to completely recover from the symptoms that they were facing at that time. And we've had consistent results in the last 7 years with whoever has gone through our protocol of lifestyle changes, dietary changes, as well as exercise and exercise modification based on yoga.
I have lost 7 kgs in my entire 2 months program. My skin has become much clear. I got my periods for 4 days and without any pain. I did not have to take any painkillers.
I was diagnosed with PCOS 8 to 9 years ago. Since then, I never had a natural period. But within joining 20 days of this program, I got my first regular natural period.
So in fact, as a doctor, I also used to wonder about 10 years back that how come we have so many PCOS patients coming to us. In my alone OPD, if I see 50 patients in a day, 20 of them have PCOS. So what do you think, Arun, is the reason of rising incidence of PCOS in today's times? Like so many years back, my mother, my grandmom, even I did not have PCOS. What do you think?
So we live in a very complex and difficult world where there are many variables. And the way I explain it is that there is a very high level of stress that, for example, you maybe in your growing up years, definitely your mother and definitely your grandmother did not experience, that are faced now by modern women. So stress is one major factor.
Yes.
And I think I have explained that to you as well personally about your own health, how stress.
I have learned a new term from him, which is superwoman syndrome.
And this is something where women are multitasking and they are going out a lot and they have a lot of portfolios to handle. And in none of those portfolios are women taking a back seat or a back step. They really have to perform. And this is one of the reasons why there can be a breakdown of the hormonal system. The other two or three very important factors, one is pollution. And when I use the word pollution, I use it in a very generic way. It includes the food that we eat, for example, genetic modification of food. There is also preservatives and toxic chemicals that are there in food. There is also a major corruption in the food supply chain. Yeah. So we don't get food which is of that kind of quality that maybe a generation ago people used to get. And there is a lot of toxicity and pollution as far as social media, use of devices. Consumption is not only about eating through the mouth, but it's also eating through what you hear and what you see.
You're consuming through all the senses.
You're consuming through all the senses. The other two factors, one is the kind of habits that we have. If you sleep late at night and get up late in the morning, or you have many other small habits which are detrimental to your health, they all add up over a period of time. And the last thing is, of course, ignorance. These are four factors that I feel that if a woman has a hold of, then she can definitely get her health back.
Absolutely.
And according to yoga, we have to look at this rather than what is the end result, which is polycystic ovarian syndrome.
Correct. So that's where comes in the holistic picture of yoga, where we talk about not just the asana practice, we talk about the correct breathing, we talk about the relaxation, we talk about the finding, doing the right things for ourselves, the positive state of mind. Like you said, constantly we are in a negative state of mind, constantly running against time, constantly trying to prove it to the world that we must reach someplace. So that's what led to the genesis of our program, and we so proudly announced the launch of our program on PCOS, which Maitri is doing with SivanandaYoga Centre, Gurgaon. So it is launching on 20th of August, and it's an online program. It will be 3-month long program wherein you will be supervised medically also.
The program is in all 12 weeks long, and the yoga classes will be online. It's a 2-hour class. Even if you have never done yoga before, you can come and participate. We'll teach everything from the basics. The classes will be from 7 to 9 in the morning on the weekends. So if you're working, then this is for people who have time on the weekends. We'll be practicing some very hard exercise in these 2 hours. What will we be doing? We'll do some very good work together. Part of the program is the practice of asanas, pranayama, relaxation, Surya Namaskar, also some cleansing techniques. These are the things that we will learn in the classes. Even if you're a beginner, the classes will be very soothing, very enjoyable, and you will really find them very useful and beneficial. Part of the class will be some very important discussion. Based on the factors that I've just mentioned, we will look at what creates stress and how to cope with it. We'll discuss food and food habits. We'll look at daily habits. What are the things that if you modify slightly, you will start to feel physically, mentally, and emotionally much better. And then from Monday to Friday, you will have some homework to do. And that is also very good because you will be creating a new habit pattern for your living, which is normally called as a daily lifestyle. So you will, over a period of 3 months, be able to modify and change many of the things very slowly and make them a part of your daily life.
So do you think 3 months is a good enough time for people to see the changes?
Well, it's a great beginning, and I believe it's a wonderful investment.
Yes.
Even if the person participates in the 12 classes, she will get profound amount of benefits. Physical fitness, flexibility, strength, agility, mental well-being, concentration, reduction in stress. Yes, 3 months is enough to see medical results as well.
Yeah. And I really feel 3 months is enough time to learn something new, which you can use it throughout your life. It's a lifelong learning, which you have to start somewhere. And 3 months is a very, very good time to do that. So please note down this date, mark your calendars. It's starting on 20th of August. You can also call at the numbers below. You can also click at the link below. You can also find out more information about this on the Maitri's website and on Sivananda's website also. And we definitely hope to see you with us online.
Thank you, Anjali, for inviting me on the show once again. And yes, I hope to see all of you who are there watching the show and you would like to participate in the course. Do join us 20th of August online. Thank you.
Thank you.